Hello, I'm Dr. Gould, the rising fourth-year anatomic and clinical pathology resident, and with me is Dr. Klonoski, a rising neuropathology fellow. Today, we're here to talk to you about neuropathology outreach in Ghana as part of the ASCP, or the American Society of Clinical Pathology Global Health Fellowship. So just for some background, to look at global neurosurgical density and growth, on the figure here on the right, we see the density of neurosurgeons with areas that are green being more densely serviced by neurosurgeons and areas that are red having less neurosurgeons. And as we see, the continent of Africa, and especially sub-Saharan Africa, is grossly underserved by neurosurgeons. And the availability of neurosurgeons has increased in all geographic areas over the past decade. However, there's still a growing need in the African continent. There's estimated to be 22 million additional needed neurosurgical procedures in low to middle income countries that primarily are composed of trauma, surgeries, hydrocephalus, infections, and dystrophic conditions. However, in these countries, there's similar rates of neuromuscular diseases, CNS tumors, and neurodegenerative diseases. However, those are not as commonly operated on because of the lack of neurosurgical expertise. And currently, there's no known dedicated neuropathologist in sub-Saharan Africa, though there used to be a neuropathologist in South Africa. He's no longer practicing there. So ASCP, as I said, is the American Society for Clinical Pathology, and they offer a global health fellowship every year. Last year, Josh and I applied for the fellowship, and both of us were awarded that fellowship in 2020. However, due to the pandemic, we were not able to visit the sites that we had planned on visiting. ASCP has sites throughout Africa, South America, and Southeast Asia. Our reason for choosing Ghana is the site that we wanted to work on is based on the University of Utah Department of Surgery's presence in Ghana, and as well the medical laboratory program has great collaborations in Ghana, and we were able to build some connections based on those already established connections between our university and universities in Ghana. So the doctors we were associated with right now are Doctors Adjei, who's at Kath or Komfo Anyoke Teaching Hospital, and Dr. Abrahams at Korle-Bu in Accra. And while we were planning on going to both of these institutions in October of 2020, due to the pandemic, that's been pushed to February of 2022. And we've been able to push the funding from this fellowship to that year as well. So here on the left, we see Dr. Adjei, and here on the right, Dr. Abrahams. Ghana's population is 31 million. Accra, where Dr. Abrahams works at Korle-Bu, is the capital city and has about a 2.5 million population, whereas Kumasi, where Kath is located, and Dr. Adjei is the head of the Department of Pathology there, has 2.1 million people. There's 15 neurosurgeons servicing the entire population of Ghana. And in 2019, the vice president of Ghana, Dr. Bawumia, announced a future neurosurgical hospital. However, it seems as though plans for that hospital have been delayed by the pandemic.
So here we outline the neuropathology outreach in Ghana, which will primarily consist of daily didactic sessions for the pathology residents and attendings. We're also going to bring WHO CNS tumors classification books with us as gifts for the residents and attendings. And we have this resource, the Electronic CNS Anatomical Atlas and Quizzes. That was actually created by Dr. Townsend, the retired neuropathologist from the University of Utah, here on the right. We're also going to assist their neuroautopsies. Now, they do a lot of autopsies in Ghana, primarily because the autopsies are centered at the hospital instead of the usual forensic and mortuary services provided in the US and other countries. So that's a tremendous opportunity for us as well to lend some expertise. We're also going to look whatever current selected cases they may want us to review as far as anatomic pathology and specifically neuropathology. We'd be happy to assist them in those current cases. And we're going to review the complete history of neurosurgical and neuropathology cases at both sites. And we're going to be at each site for about 2 weeks each over the course of a month. Also, we're going to set up remote lectures for pathology attendings interested in global health here at the University of Utah. We've previously sent out a survey to those faculty members that have replied and designated their interest. And we have these, well, Eric just digitally scans these educational slide sets for pre and post assessments of diagnostic skills in neuropathology. And here on the right, you actually see the Aperio system, where we have a tray on the left of cases, neuropathology cases, and on the right, you see a representation of one of those cases. It's actually glioblastoma. You see that palisading necrosis in the central area of the slide. And so this is a resource where we can actually show them, you know, some case examples from our inventory at the University of Utah that they can access remotely in Ghana. And we can use that to kind of show the improvements over the month of didactics. And then we're going to, obviously, we want to show that the improvements and sustainability. So we're going to use GraphPad Prism to map the pre and post assessment surveys and other quizzes and surveys as well, and use appropriate statistics. So the sustainability is something we've really kind of started with in mind at the beginning of the project. And so we chose partners that, again, ASCP has sites in all over the world, especially in Africa. And so beyond that, we also, again, chose a site that had a good partnership with the surgery, Department of Surgery here at the University of Utah, as well as MLS. And then it's interesting, there's actually some outreach already from folks in British Columbia, and this is the Corley Boone Neuroscience Foundation. So we could already reach out to them, and hopefully we can partner with them to provide additional resources and opportunities. They service not only Ghana, but they've also visited other countries in the area. And then, as we mentioned in the previous slide, we've already sent surveys to our faculty members, and we've selected, or people have volunteered and shown their interest in global health. So we're hoping to take advantage of those people to provide additional lectures like sarcoma and breast service in Ghana that are really heavily needed additional topics in Ghana to increase the breadth of our sustainability efforts. And then the digital presence, we think that the pandemic was a great opportunity to really establish a digital presence. And so here to the right, you see this camera system that can be attached to almost any scope, and that will interface with the computer. And so they can actually not only attend our lectures online at the University of Utah, they can actually communicate their case or show their cases to us and our faculty members here at the University of Utah. And we had this idea for a faculty resident exchange. And so this will be outlined or worked out in the future, but one idea is that the faculty members would come over here for a certain period of time, and our faculty members could go over there for certain periods of time, and this could continue on in the future, establishing that sustainability effort. And then as we go forward, we're also looking at, cameras and slides and slide scanners and immunohistochemistry that the ASCP can help us actually find that equipment, as well as, perhaps used equipment or lightly used equipment from the University of Utah could be repurposed for use in Ghana. Thank you for listening. I really appreciate your attention. If you guys have any questions, here's our email addresses as well as our social media. Thanks, Eric.